Hi, this is Dr. Poole and another chalk talk on non-neoplastic adrenal pathology. I'm again just going to go through some of the morphology to supplement the readings and the study guide. So you have some pictures with words. So to start off with a baseline of normal, these are cross-sections of normal adrenal glands highlighting the adrenal cortex, which usually has a yellow-orange color and is marked by the red arrow, and the inner adrenal medulla, which has usually a grayish appearance and is marked here by the blue arrow. And we can distinguish these microscopically as well. So microscopically, we also have the adrenal cortex, which is divided into three histological layers. The glomerulosa is closest to the external capsule. The middle layer, which usually forms the substance of the cortex, is called the zona fasciculata. And then finally, the zona that's closest to the medulla and is the most lipid-poor area is the zona reticulata. And then encircled in the yellow free form is the medulla. And I'm not going to be talking about the medulla at all. We'll come back to the medulla in a later course. This is just an overview of some of the entities that I'll go over in a little bit more detail so that you can appreciate the morphological differences between these different types of pathologies. First, this is a slide to help you distinguish between normal adrenal gland, which is represented here in the middle, and atrophic adrenal glands, which are at the top, and then enlarged or hyperplastic adrenal glands, which are at the bottom. So just keep this picture in mind as we go through some of these entities. The morphology of Cushing's syndrome depends on the cause of hypercortisolism and can show one of the following abnormalities. In patients with exogenous Cushing's syndrome, suppression of endogenous ACTH results in bilateral cortical atrophy. And this is similar to cortical atrophy that's seen in chronic adrenal insufficiency or Addison disease. So just keep that in mind, that the atrophic appearance can be seen in both. You can have hyperplasia, which may be diffuse or have a macronodular appearance, so we'll look at that. So the adrenal glands in hyperplasia are replaced by prominent nodules of varying sizes. And what distinguishes diffuse from macronodular is the presence of relatively normal adrenal cortex in diffuse hyperplasia, whereas in macronodular hyperplasia, the entire gland is replaced by nodules. That's the only difference. Otherwise, microscopically, they appear exactly the same. They have a mixture of lipid-poor cells, which resemble the zona reticularis, and lipid-rich cells, which resemble the zona fasciculata. And then finally, Cushing's syndrome can also appear as a result of adenomas, which are benign proliferations of adrenal cortical cells, or adrenal cortical carcinoma, which is of course malignant. This is a gross picture showing the cut surfaces of an adrenal gland, and there is still a vaguely nodular appearance to it, but there's more diffuse enlargement of the gland. And we'll compare that with this next image of cut surfaces of an adrenal gland showing macronodular hyperplasia. You can see these nodules of varying sizes. Again, microscopically, both forms of hyperplasia appear similar in that there's a mixture of lipid-poor cortical cells indicated by the red arrow. They have a more reddish or eosinophilic cytoplasm, and lipid-rich cortical cells, which because of the lipid have a more clear appearance and are marked by the blue arrow. Now this really wasn't covered in the notes, although it's referred to in the readings, but I just wanted to show you an example of adrenal cortical adenoma. Most of these actually are incidental findings and are clinically non-functional, but they can be hyperfunctional and cause Cushing syndrome. So these tumors are bright yellow, well circumscribed, and have a thin capsule, and they're typically composed of cells that are similar to the zona fasciculata with abundant intracellular lipid. So the arrow points to the obvious nodule. Again, they typically have a bright yellow appearance, and microscopically they're composed of cells that have abundant lipid-rich cytoplasm. Remember, in adrenal cortical insufficiency, we can divide this clinically into acute and chronic forms. In acute adrenal cortical insufficiency, you typically see hemorrhagic infarction of the adrenals, and microscopically you would see acute hemorrhage and infarct of the gland. When this occurs in the setting of overwhelming sepsis, particularly from Neisseria meningitidis, this refers to the Waterhouse-Friderichsen syndrome and is accompanied by other clinical manifestations as well. In the adrenal gland, however, both adrenal glands show extensive hemorrhagic infarct and hemorrhage, and this is reflected by the dark black, bluish red appearance of the adrenal glands. And microscopically, we see extensive acute hemorrhage and infarct of the adrenal cortical cells. In chronic adrenal cortical insufficiency, the adrenal glands are irregularly shrunken and atrophic, and thus resemble the cortical atrophy that you can see in patients with exogenous Cushing syndrome. That is, people that are taking exogenous glucocorticosteroids and producing the typical clinical features of Cushing syndrome. Microscopically, you typically see a lymphocytic infiltrate of varying intensity, and of course there's atrophy of the cortex and replacement of the atrophic cortical cells with fibrous tissue. If we go back to our original image, the middle adrenal glands indicated by the white arrow are normal, and we compare those with the atrophic or shrunken glands that are in the red circle. This isn't the greatest picture, but the larger image, if you compare with normal adrenal gland to the right, shows loss of the adrenal cortical cells, and all the numerous small purple dots, you'll have to take my word for it, are lymphocytes that are infiltrating the gland. So sometimes this is called autoimmune adrenalitis, and is what's seen in chronic adrenal cortical insufficiency or Addison syndrome. Okay, so that's it for the adrenal cortex. I hope that these images and my guide through them helps you reinforce some of the descriptions that you find in the readings and in the study guide. Make sure you look at the figures in the readings. Those are quite helpful too, and there's also some clinical pictures that help reinforce the signs and symptoms that you see in Cushing syndrome and Addison syndrome respectively. Thanks.